All right, let's talk about something that affects pretty much every single one of us, whether we realize it or not. We're diving into the world's #1 killer, cardiovascular disease. Now, it sounds complicated, I know, but getting a handle on the basics, that is the most important thing we can do to protect our hearts. So let's get right into it.
So, just how big of a deal is this? Well, check this out. Cardiovascular diseases, or CVDs, are responsible for nearly a third of all deaths around the world. I mean, just look at that number, 32%. That's a staggering figure that makes this the single biggest health challenge we face as a planet. And if that percentage doesn't quite hit home, let's put it in real numbers. We're talking about almost 20 million lives lost in just 1 year. This isn't just a statistic, you know? It's a massive global health crisis happening right now, every single day.
Okay, so let's really dig in and understand what we're talking about when we say this is the world's deadliest disease.
First off, cardiovascular disease isn't just one single condition. Think of it more like an umbrella term for a whole family of problems that mess with your heart and your blood vessels. But they all share one big, dangerous similarity. They disrupt the flow of blood that your body needs to survive.
So, let's break that down even more. When you hear someone say heart disease, what do they actually mean? Well, it can take a whole lot of different forms.
This table here gives us a good look at some of the heavy hitters. For instance, you've got coronary artery disease. That's when plaque builds up in the arteries of the heart itself, and that's what can lead to a heart attack. Then there's cerebrovascular disease, which is about the blood vessels in your brain. That's what can cause a stroke. There are a bunch of others, but you see the pattern, right? It all comes back to that same core problem, messing with blood flow.
Okay, now that we know what these diseases are, let's get into the why and the how. Why do they even start, and how might your body try to warn you that something is wrong?
You know, the easiest way to think about the root cause is to just imagine the plumbing in your own house, right? Over time, if gunk builds up in the pipes, everything slows down, and eventually you've got a major problem. Well, basically, the exact same thing can happen inside our bodies.
That clogged pipe scenario has a fancy medical name, atherosclerosis. It's just the slow, steady buildup of these fatty deposits, we call it plaque, on the inside of our arteries. And as that plaque grows, the highway for your blood gets narrower and narrower. And that's what sets the stage for all sorts of trouble.
So, what causes this plaque to build up? The risk factors really fall into two main buckets. On one side, you have our behaviors, what we eat, how much we move, if we smoke. And those choices often lead directly to the other bucket, the clinical problems, like high blood pressure, high cholesterol, or diabetes. For example, high blood pressure is like constantly sandblasting the inside of your arteries, creating little rough patches where that plaque can just grab on and start to build.
So, how would you even know if there is a problem brewing? Well, our bodies are actually pretty good at sending up warning flares. Chest pain, or angina, is that classic sign that your heart muscle just isn't getting enough oxygen. But other signs, like getting out of breath easily or feeling numbness in an arm or leg, could signal problems too. The bottom line is, you have to listen to your body. These are not symptoms you ever want to ignore.
Now for the good news. We live in an age we have incredible tools to figure out what's going on and to fight back hard against these diseases.
It all starts with the basics, right? A physical exam, some blood tests to check your cholesterol and sugar, but from there, doctors can use some amazing tech to get a better look. An ECG, for instance, is like an electrician for your heart. It checks the electrical signals. And an echocardiogram uses sound waves to create a live video of your heart beating, so they can see exactly how well it's pumping.
When it comes to treatment, it's really a three-part strategy. Yeah, we have amazing medications and even surgical procedures for serious cases. But you see that first pillar? Lifestyle changes. That's the foundation for everything. Honestly, without it, the other two just can't do their jobs as effectively.
And that brings us to what is, without a doubt, the most important and empowering part of this whole conversation: prevention. Because the absolute best way to fight heart disease is to stop it from ever getting started.
I want you to just let this statement sink in for a second. Most cardiovascular diseases are preventable. This isn't about bad luck or destiny. It is about the choices we have the power to make every single day. We are way more in control than we think.
And what's so wild is how perfectly the problem mirrors the solution. Look at this. The biggest behavioral risks, what you eat, how you move, if you smoke, have direct one-to-one solutions. The problem and the answer are literally two sides of the exact same coin.
So here it is. This is your blueprint. Number 1, eat a healthy diet. 2, get regular exercise. And remember, consistency beats intensity every time.
3. Avoid tobacco. It's the single best gift you can give your arteries. 4. Know your numbers, your blood pressure, your cholesterol. And 5. Manage your stress, because your mind and your heart are so deeply connected.
And this is so much bigger than just our own personal health. It's a global priority. Over 3/4 of all deaths from CVDs now happen in low and middle-income countries. In places where access to expensive treatments can be really limited, prevention isn't just the best strategy. For millions of people, it is the only strategy.
So yeah, the statistics can seem overwhelming. I get it. But the real message here, the one I really want you to walk away with, is one of incredible hope and empowerment. The future of your heart's health isn't set in stone. It's a story that you get to write, chapter by chapter. Which brings us right to the final question. A question for you. Knowing that you have this power, that most cases are preventable, what is one small, manageable change you're going to make starting today?